to have you on board. So in today's webinars, we will be diving into deep about the orientation of MRCPCH clinical exam. And these are this is the outline of my webinar. That is, I will talk first about the introduction of clinical exam, about the format of the exam. Then we will talk about the detailed discussion of the domains and the mark sheet. We will discuss about the pass mark of the clinical exam. And in the end, there will be a Q&A session to answer all of your queries that are related particularly to orientation of MRCPCH clinical exam. So I have tried to bring all the FAQs and all the questions that I was getting in inbox to try to answer in this webinar. So I hope that everyone joining today has already done the theory parts and know about it. So there are 3 parts of theory exam: FOP, TAS, and AKP. And for sitting in the clinical exam, it is mandatory that all of these 3 parts are passed. And there are 3 dates per year that happen for the clinical exam. Before you apply, you will need to have passed all the 3 theory exam for MRCPCH clinical. And to optimize your chances of success in exam, a training period of 2.5 years from your graduation date is recommended by the Royal College. For UK candidate, you must not have set the exam 6 or more times. But if you have set, then you will have to contact the exam team and they will guide you further. For all the applicants, please note that the 7-year registration period applies. This refers to the rule that you must pass your MRCPCH clinical exam with 7 years of passing your final theory exam. It can be either FOP, TAS, or AKP. So about the exam logistics, the exam center is in the UK. In the UK, there are multiple centers and exam is conducted in all over the UK. However, in Asia, there are certain countries like Pakistan, Nepal, India, Hong Kong, Malaysia, and Singapore. In Middle East, it is the Kingdom of Saudi Arabia, Oman, UAE, and Egypt. So exam cost varies from somewhat between £833 to £1605, but it varies from country to country. So you can check the more details on the website because this exam fee is updated every year. Application window will be open on the set date and time mentioned on the official website. So while filling the form, you need a supervisor reference. So it can be an RCPCH fellow, or for the overseas candidate, it can be your local supervisor. But keep in mind that with this supervisor, you must have worked for at least last 3 months. And this is a tip, golden tip, that book the exam on the same day as the seat fill fast and payment later, and the payment occur later. So once you once you book the exam, you have to wait for 4 weeks. And after 4 weeks, you receive a mail. So either you are accepted and offered a place in exam. At that time, you have to do the payment. But keep in mind that this payment window is open for a limited time, maybe 5 days. They will give the time frame and you have to pay within this window. Otherwise, the seat will be handed over to another candidate. So this is an official website from where you can have more and more information about the dates of the exam and how to apply. So how to book the exam? This is a very important point that whenever you are booking the exam, so you must use a latest version of the Chrome, Microsoft Edge, or Safari. Because if you are using an outdated version, so there will be difficulties maybe in booking the exam, and as all of we know that the seats are very limited. So you have to log in into RCPCH account. After you log in, you will go into the dash box and go to the exam block. Here you can register or book your exam. So here, when you go in the exam block, you see two windows. One is about the exam progress. It means that either you opted for the MRCPCH route or the DCH route. So that will be visible. And whatever parts you have passed already, there will be a small tick applied beside that part. And whatever left will be shown. Also, this window will show the available booking if it is present, and you can do the booking. So this is a very common question. Everyone before booking the exam always asks that whether they will be able to get the seat or not. So there is different criteria for allocation of spaces for the UK candidate and for the overseas candidate. So for the UK candidate, the first three priorities, keep in mind that are the candidates who are already working or residing in the UK. So for the first priority is the candidates who are at career critical stage. This means they are in training. They are trainees and they are within stepping up. They are in the critical state, which mean that within 6 months, they have to step up to ST5, or non-trainees in the UK. They are applying for ST4 or ST5 training. So the second option is also the UK training candidates, which are nearing the 7-year registration period. After this comes the window for the candidates who are not working, but they are residing in the UK. And there is no priority here for the 7-year. So first three priorities are always given to the people who are residing inside the UK. After this come the turn for the candidates who are working overseas in the countries where no exam center is offered. So there are still chances that you can get the seat, but maybe you have to face the wait list or rejections. Now, this is the criteria for allocation of spaces for the overseas candidates. So what does the host country mean? Suppose you're working in Oman and you're also living in Oman and you want to apply for exam in the Oman. So you will be given the preference. So the candidate who work in the host country and they have the 2 years left in the 7-year period. So this means that 5 years have already passed. So they are the high chances they will get the space. A second order is the places or the countries where there is no MRCPCH clinical center and they are also in the final 2 years of 7-year window. Third chance is for the candidate who are working in the host country, irrespective of the time frame, either they have freshly given the exam. So that what we recommend is that whoever is working in the host country, go for your host exam center. You have high chances of acceptance there. So candidate, and after that come the candidates where there is working in the countries where there is no established MRCPCH clinical host center, and other countries is down the list that if you are working in the country where there is already a center, so you're down the list and there is very less chances to be space allocation. Suppose, congratulations that you have got the seat, and now there's some golden tips for the exam day. What you should do, you must reach the designated center 1 hour before the start of the exam. And when before 1 week or like 14 days, you will get an admission form from the Royal College. They will mention the date and time of the exam. And you will then, so you already know about the exam center. So you have to reach 1 hour before. So you have to dress smart and comfortable, take your ID, the stethoscope, pencil and torch is optional. They will provide the pencil, but it's better to have one ready in your pocket. In that day, the senior examiner will give a brief overview how the exam is conducted, and they will give a tour of how the stations are, where they are, and they will just give a brief overview for the exam. So I have seen personally that the candidates don't know that they have to reach the exam 1 hour before, and then they panic. They reach on the same time when the exam is starting, and then the things go upside down, and the reactions start and they end up in mess. So if any mishap happen during the exam, there is chance to give feedback in the end to the senior examiner. However, the chances of mishap are very, very rare. It do happens, like if there is a video station, your sound is not playing or some problem happen, so they are going to solve it. minded that the happening of this error are very minimal, because the exam is very well organized and conducted in a very timely fashion and organized, and every thing is checked. So let's talk about the format of the exam. So currently the exam is face-to-face, which have patient in all the 4 clinical stations, except the developmental station that still is scenario-based. There are total 10 stations, and the exam duration is 2.5 hours. So it's a one-day exam only, and there are 2 sessions in one day. There is one morning session, usually, and one is in the afternoon session. So it's a OSCE-style exam, and once the exam is started, there is no break between the exam circuit. So keep in mind that if you want to empty your bladder or anything, you should do it before the exam. And if you are going in between the stations, they will not give you extra time. This is the face-to-face circuit. So there are 10 stations, as I mentioned. So here, there are some stations are long, some are short. So here you can see that there is a station 1, 2, 3, 4. In the start, there are 4 short clinical station. Then station 5 is the developmental station. This is a long station. Here it is written 2. 2 mean that there are 2 stations going side by side. One is labeled as blue and other is red. So the developmental scenario that came on the same day for the morning session, let's say, will be same in the blue and the red. However, the examiners will be different. So in the history station also, there are 2 stations going side by side, as in the development, blue and red. And these 2 stations are the long station. They are 22 minutes. After this, you have the communication station A and B. This is 9 minutes, and video station E and B. Now, what happened that you can enter it at any stage. Suppose you can enter here in developmental station. This is station 1 for you. So they will give you a flow sheet similarly for every candidate. Suppose I have to enter in the developmental station, so I will arrange my mark sheet in that order. I will first keep the developmental station mark sheet. At the second, there will be history station, and there will be communication will be third for me. Then there will be communication B will be fourth for me, and so on. So everyone is given this paper on the day that they will, before entering in the exam, they know where they are going to stand. And everyone will be standing in front of their exam station, and everyone will be entering at the station at their respective stations. So for every candidate, the exam entry station is different, but ultimately you have to go through circuit and all have to complete this exam. So this is the more breakdown of the marks. So there is total marks is 82. So here we can see that there is 82 marks exam, and the clinical 4 stations, they are 8 marks. After this is the developmental station. That was the longest station, and that 22-minute station, and it carries the highest marks. Then there is history station. That is also long station. It carries 10 marks. Communication, both station carry 8 marks, and the video has the least mark, that is 6 marks for one video. So it's very mandatory to understand about the domains. If you will understand about the domains, so you will be better performing the exam. And also you will have orientation about the mark sheets and what the examiner are expecting and what they are looking on that day. So here you can see the domains. There are A1 and A2. Okay, sorry for that. So A1 and A2, they are related to the information. So one is information gathering, other is information collection. So keep in mind there is B. B is for physical examination. C is for the identification of the clinical sign. D has again 2. The one is the clinical reasoning, other is the management and planning. Then E is the 3, E1, E2, and E3. That is important for the communication. They are checking the rapport and the communication style. E2 is verbal and listening skills, and E3 is managing concern and agreeing next step. So you can see that in clinical station, they are checking only the domain B, C, D1, and D2. The shaded areas are not tested. So you're not going to gather the information, or you're not give any information sharing is there, not there. So you can see that here in all the clinical station, only this B, C, D1 and D2 is tested. Now in the developmental station, you can see A1 is tested, this mean information gathering. And here you can see the E1, communication and style and the rapport matters. Similarly, in the history, you have the same as the development, only the physical examination you are not supposed to carry here, no signs, identification of sign in the history station. However, they are checking the listening skills. And in the communication, they are looking for the A2, that is information sharing. And all the E1, E2, E3 is very important for the communication, and they are allocated marks for this. And you will now see in the mark sheet that how if every marks are given against each domain. In the video station, again, you are only checked on C, D1 and D2. So for each domain, the purpose of showing this domain is to you should know that how much important is that domain and how much time you should allocate to prepare for this domain. So the highest domain here you can see is the clinical reasoning and management planning. Then the identification of the clinical science is also has very high marks. However, we cannot ignore the marks that the communication style, the repo carry, and the listening skills and the verbal skills carry. So this is the total exam marks. Now, here we will discuss the station step by step. So this is the short clinical station. Here we can see that this is the time flow chart. So when you understand this time flow chart, it's very important for you that you have, you know beforehand what to do in the exam and what I will be expecting. So in between there is a time of 3 minutes. When you are sitting outside the station, you are preparing what to do in the station. But when you are sitting at the 3 minute outside the clinical station, so maybe there is no clue, or maybe there is some photo outside, but usually nowadays when the exam is started face to face, usually you don't know what station is inside. It's not labeled, and you have to sit in the 3 minute area and you have to wait. After that, there is a bell. You enter in the station. This 6 minute time start here. So here we can see that you are going to be tested on the domain B and C. So B mean that you have to take when you enter the station, the examiner will introduce himself and will give you an opening statement. So I will show the example in the next slide how the opening statement is. Then you will carry out the focused examination. You will do the clinical signs, whatever the signs are elicited, and then the examiner will also ask about the interpretation of these signs, and you will about the diagnosis and differentials. So here is the 3 minute warning bell. So you can see that how many things you are doing in these 6 minutes and how much fast you should be in the examination. Because to reach here, you should tell the diagnosis and differential within these 6 minutes. If you will not tell, then here the 3 minute warning bell will happen. And in the end 3 minute, they are asking only about the D2. And in the D2, they are asking about any complications, investigations, management, and this only has the domain of D2. So it's very important that whenever you practice the stations, you keep this flow chart of time in front of you and practice accordingly. You should what key areas like here you have to know about the complication, investigation, differentials. So you have only focus on these key areas. Here I will show you some of the example of short clinical cases. There's only one patient in the station. So the case can become from cardiovascular, from the neurology, from the musculoskeletal, respiratory, abdominal, nephrology, hematology, hepatology, ophthalmology, and there can be syndrome. So any one of the case can be there, and there is very less chance of repetition. Suppose you have a cardiovascular station in one of your exam station, so it's highly unlikely that you will face another station of the cardiovascular. Here is the examples. I have given this example to clarify how you will, the examiner is going to give you the opening statement. Here the examiner is saying Anita is a 14-year-old and has a difficulty in walking. So Anita will be inside the room, maybe with parent or maybe alone because this is 14-year-old. The examiner will give you a command, please undertake a peripheral neurological examination. So this is a brief opening statement after a short intro in one sentence. They are telling you to proceed. So here it is the golden tip for the exam. If you are not sure which system the examiner is asking you, you should make clear at that time that what station he specifically want. If you are not clear, and if the command is very clear, you can proceed. Your time has already started the moment you entered the room. So we will see another example. Nayan is an 11-year-old and has a chronic kidney disease. So examiner have given you a command, please undertake an abdominal examination. So you will proceed for the abdominal examination here. Example 3 is the Richard is 7-year-old and has been referred by his GP after finding a murmur during an examination for a chest infection. Examiner will say that please undertake a cardiovascular examination. So usually the opening statement is very clear, and but you have to be listen actively at that time, because in the stress of the exam, these things can be missed and you can misunderstood. So here is the mark sheet. I have bring only one mark sheet for the clinical station because rest of the mark sheet are according to the domains. So just I want to show you that here the domains which we discussed, C, D1, E1. So here the domains are written at the side, and only these domains are tested. So we are not going to test all the the other domains are not tested. So here is the domains. Here it is written the meet standard, borderline, and below standard. So this is the here you have to write the candidate number that will be provided to you on the same day, or on the same day, and you have to write your name with the pencil before handing in the morning, 1 hour before the exam, that I told you that you have to come and arrange your mark sheets. And the examiner will be writing here, this is the examiner number, and here he will be writing about the date, time, age of the patient, and here it is about the case description. So this is the cardiovascular station, respiratory, or whatever he will just shade that area, and also about the cooperation of the child, that the child is hesitant and unwilling, or he is cooperative. So it will, because if you will not worry that the child is hesitant or the child is crying and I'm not able to perform the examination, it will affect my marks. This doesn't happen, because all of we are human beings, and the examiner will mark here if the child is hesitant or the child is not cooperative. So here is the, I was discussing about the standards. So if you meet the standard, you will get full marks in that domain. However, if you are borderline, like if the examination is not very fluent and you miss some of the signs, you will get a borderline. And below standard, if you're not able to elicit the sign, or you do not pick the sign, or interpretation of the sign is not correct, or the reasoning is not correct, the differentials are not formulated properly, so here below standard will be marked. This is the page 2 of the mark sheet. Here it is also for the examiner, the same domain BC, D1, E1, and here when they are written in detail, what is the meet standard, what is the borderline standard, what is the below standard. So what I will recommend you all, that you should print a mark sheet for every station, and whenever you are practicing, you just keep the mark sheet in front of you and do the marking on it, or at least prepare according to the style of that. Here in the end, there are some comments of the examiner. If you have done any mistakes, they will write here. If you have done good, so this they will write well done. And you will be getting the mark sheets after your exam, the feedback of the exam. after result, maybe day one or two, you will be getting the detailed mark sheet in which they will be mentioning everything. So unfortunately, if anyone does not pass, so they can know at what point they made the mistake. So let's now dive into video station. So the concept of the video station is that they are bringing the topics that cannot be brought in the real life, and they convert emergencies. As all of we know that we can't bring a unstable or a sick patient to the exam station, or patient having gait difficulties, any murmurs, any crackles, any rashes on the skin like lumps and bumps, cases of non-accidental injuries, and the patient with the mental health condition. So the concept is that emergency cases, the video station length vary between 30 seconds to 1.5 1 minute to 30 seconds. But mind that there are some videos that are long, that can be 2 minutes or even 2.5 minutes. So keep in mind that when you're watching the video, you are writing along with this the signs which are visible, because sometimes if the video is long, so you don't have a time to watch this video again. Here is the screenshot of like what will be you doing in the 3 minute outside the video station. In face-to-face exam, there will be maybe small sentences written outline outside the station is there. It is labeled that this is a video station, and there is a statement like this is a 3-year-old child brought with rash, and you will be sitting outside for 3 minutes doing nothing, and just make the differential in your mind that what according to the age what it can be. Suppose it is here written like a 6-month baby with a breathing difficulty, so you can just predict what can be there, but you cannot do anything here. You can just write the format that what you are going to do inside. Now you have entered here, the bell ring, and you have entered into the examination station. At the examiner will introduce himself, and there will be a statement. Maybe sometime the statement is written outside on a paper, and sometimes the statement is not written inside, and the examiner can give you the introductory statement, or it can be present on the paper beside the laptop, so you have to just see. So here the video clip will be played during the 3 minute of the station. So if the video is short, let's say 1 minute, so you can see it twice. But we really do not recommend to see the video twice, because once you see the video, you organize yourself how I'm going to present it, what are the signs. So when the 3 minutes are passed, there is a bell and the candidate will stop the watching video. And now here is the examiner time starts. So you with the examiner, you have total 6 minutes. Okay. So in the 6 minute, the domains which we have already discussed, C and
ما بسمع هندية ما بسمع.
in the first 3 minutes, and in the next 3 minutes D2 is discussed. So what here happened here, that the examiner will ask you to summarize and tell the clinical signs which you have elicited, and what is your diagnosis, what is your differential. Then the 3 minute warning bell happens, and then in the end you will have to tell about the management planning and investigation, whatever the examiner want to ask. So here the more focus is on the C domain, D1 and D2, and in the marking sheet also only these domains are mentioned, and you are marked against these domains only. So here I have brought the expected domains, like what the examiner expectations is and what they are looking specifically for. If you have done C properly, clinical sign identification, and you will get mark here like meet the standard or borderline or below standard. Similarly, D1, in which we are doing the clinical reasoning, and here like clinical reasoning being the differential diagnosis, not only the differential, but also you have to tell that why this differential you have kept and how to exclude that differential from or differentiate that from the diagnosis. In the D2, you have to tell about the management planning and what problems the child is having. You have to tell all the points, and if needed, referral or escalation. So here again is a one exam tip that don't forget to wear the headphone that is present by the side of the laptop that can be easily forgotten under the exam stress. This happened with a lot of candidates and they realize after 3 minutes, but the time is passed. And we know that in the video station, the sound is vital. Without a sound, you cannot diagnose that what is in the happening in the video. Is the child coughing? Is there crackles? Is there any murmur? So don't forget to wear the headphone. Now let's talk about the communication station. So again, this is the timing flow chart. Here in the communication station, you will be sitting 3 minutes outside. Again, there you will be given a candidate information sheet. So you will be reading this candidate information sheet and in which there will be information giving that this is your communication station and the scenario will be given and the task will be given. Then at the 3 minutes, okay, mind that you will have a A4 paper will be there, a clear A4 paper will be there. You don't have to write on the candidate information sheet because that will remain outside. You will enter with the station with your own paper. So whatever you want to write here, write on your own paper. Don't write on the candidate information sheet. And you cannot take this candidate information sheet inside the room. If you take them, they will be taken back from you. So here now you enter the station. Examiner introduce himself and the role player. Examiner will give only a brief statement that this is your communication station, and then examiner will sit back and the role player will the station will start the role player between you and the role player. The examiner will be doing no question and answer here. All the station will be happening with the role player, and when the 3 minutes are left, so there will be a warning, and whatever you have to do in the 3 minutes, you will be doing in the last 3 minutes, and at the 9 minutes, the station will end. Here they are taking your A2 domain. That is the information giving. And along with this, E1, E2, E3 that I discussed in the slides in which I show the domain, that is also tested in communication. So the main focus is the communication, but the knowledge is also it should be correct and factual. So there are different type of scenarios like education giving, counseling, critical incident, breaking bad news, conflict resolution, difficult conversation, and teenager scenarios. There is a new category that is added that is a problem solving. So you have any one of these scenario will be definitely 2 scenarios will come from any of these. Now we will look into history taking and management planning station. So in the exam, there are 3 type of histories that are coming. There is acute history, can be chronic history, and there can be acute on top of chronic. Acute can present like this is a child with 3 days history of cough. In the chronic history, this child will have, suppose this child has cerebral palsy and he presented with some complication, or you have to take the follow-up and how is this child under the care of what, and then in the acute on chronic, like the child is having celiac disease and now presented with some acute problem. These are just an examples I'm giving. This is the flow chart of the timing for the history station. Here again, 3 minutes outside before every station. So you have to read the candidate information sheet. Here again, scenario will be given. Maybe there is some audio or video or photo or any cues given outside the station. Usually that was present most of the time when the exam was without patient. And in face-to-face, but in face-to-face exam, usually the candidate information sheet is given, so focus on it. Here, the time is the 3 minutes finish. You enter into the station. This is the total 13-minute time. So when you enter the station, the examiner will introduce himself and the role player. He will give a small statement and you will start the focus history. At the 9 minutes, when the nine minutes pass, so there will be a warning bell that 4 minutes are left. So you have to just summarize whatever you want to do. You gather yourself. When 13 minutes are finished, so there is a bell here again, and now the history station came to an end with the role player. The role player may go out of the station. Now these 9 minutes are with the examiner. Here the examiner will be coming, and here the role of the examiner start. In these 13 minutes, the examiner is sitting and just observing that what you are asking the questions and what you are doing. Okay, now with the examiner, they are asking you about the domain D1 and D2. So D1 is you will discuss the problems with the patient about that the patient problem with the examiner you will discuss here, and you will discuss about the management planning usually, and they will ask more and more of questions there. But however, these 9 minutes passes quickly, then but they will ask everything: investigation, management, complication, referral, what teams you are going to involve, and then the station will finish. So the more marks you can get if you cover these 4 domains. But if you talk slowly, you are thinking, you are not well prepared. So you can just cover one domain, like, or you will just stay on the D1 and maybe you cannot reach the D2. That will affect your marks. So the purpose here, drinking and the orientation, this all the breakdown of station is to know that how the marks are given and which areas you have to focus. Now about the developmental station. So before I enter into developmental station, I want to talk about the cues. As I told that the developmental station, this is a scenario-based station. Scenario-based means that there is no real patient inside the developmental station. So before COVID, there was patient, but during the COVID and after COVID, they have not changed the station yet. Maybe this is changed later on, but we don't know. Currently, this is scenario-based patient. You don't have the real mother, so there will be a role player that will be giving you the history, and later on with the examiner, you will be doing the examination, the developmental assessment. So with the developmental assessment, when you are carrying with the examiner, there can be 2 types of cues. So the cues are very important to know in the developmental station. One is dependent universal cue, and the other is the dependent cue. So the universal cue is the cue or the sign that any candidate can discover being in the room. For example, a child is Down syndrome. So if 10 candidates enter that station, they will know that this is a Down syndrome. The examiner is not going to tell that this is a Down syndrome or this is dysmorphic, but that is obvious. This is a dysmorphic child. This is a universal cue. Then comes the dependent cue. The dependent mean that the sign that candidate would pick up had they actually assessed the patient physically. Like in developmental assessment, when they are doing detailed developmental assessment, next slide, I will show you the timing, how you will carry it out. But suppose if the candidate say that I want to see that if the child is able to make the tar and how many block tars the child can make. So the examiner will give you the only the cue only when you ask. The dependent cue will be provided only if you ask this area or touch this area. If you will not ask, the examiner is not going to tell you, even if it is important. There can be some other cues in some centers. So there can be small video recording outside in the 3-minute time, like there can be some gate problem if this is a motor station, or there can be small video, but that it can be present in the, usually it's present only in selected center, not present in all the station and all the centers. This is the breakdown of developmental station, how it is carried out. So this is the station with the highest marks, and you have to focus very much on the developmental station. Here in the 3-minute, you are sitting outside and you have the candidate information sheet in which there will be opening statement given. I will show you the example in the next slide. And there can be audio, video, or photo, and universal cue can be there, but usually sometimes they are putting and sometimes they don't put. Nowadays they're not putting because They want you to ask about this morphology in the history. Here, the 3-minute time finish, you enter into the station. Now here, the first 9 minutes, this is about the history taking. Here, the examiner will introduce, give you a statement, then you will take a focus history with the role player. When the 6 minutes are passed, the examiner will warn you that there are 3 minutes left, and when 9 minutes are passed, the examiner will stop you. So it is all about the A1 domain. In the 1 minute time, you are going to summarize. So keep in mind that your summary should not be more than 1 minute. Here you are summarizing the station in 1 minute. Now here come the 9 minutes in which you are going to do the domain B and C. So in B, you are doing the step-by-step process of how to take the developmental assessment. So you will be provided with the cues, and the examiner is going to provide you the cues. Then next, you will be tested on the domain C, in which you will summarize the developmental sign and the developmental age of the child. And when 3 minutes are left, you have to come on the D1 and 2. D2, this means the clinical reasoning, what is your diagnosis, what is your differential, and also what are the complications, how you are going to investigate and manage this case. So here comes the end and 22-minute station and this finish. This is the developmental toolkit. This picture was used in the COVID adapted exam. In that exam, the picture was present, but nowadays in face-to-face exam, they are keeping the real toys. Okay, so in front of you, you have to take these toys, you have to demonstrate. You should know that what are the items that will be present on that day. So this is an exhaustive list that I brought here. You can take a screenshot of this picture and you can keep it, and you should use these instruments while you are practicing. So this is the official instruments that will be present that day. Now you are going to be assessed on 4 areas of development, that is gross motor and posture and movement, fine motor, vision and manipulation, speech and language, hearing and speech, social and communication skill. So the good news is that there are only 4 areas. A developmental station, you have to need practice, and only you have to focus these 4 areas, but these 4 areas can come with a variation. Suppose I have brought here an example that Paul is a 3-year-old child. His parents are concerned about his speech. Please take a relevant developmental history. During discussion with the examiner, you are approached to the clinical evaluation of Noah's speech and social communication will be assessed. During the history taking, you will not ask any question about these skills. So keep in mind, this is a very important point, that when you are asking the history, you are not going to ask question about the domain that you are going to do the assessment later. Suppose here you are going to ask, you cannot ask about the speech or social communication in the history. Suppose you start asking, the examiner will, the role player are directed and they are very well prepared. They will not answer you. And this will just waste your time. And they will not give you any information. They are directed in a manner not to provide any information related to speech or social communication development. So that is your task. Now we have gone through all the stations in details, and we will now discuss what is the pass mark of exam. So pass mark of exam is set by using a modified NGOF standard setting process. So judgment of the marks is done by the subject matter specialist, and they are doing the standard setting. So the standard setting means that in the exam in the morning, suppose 4 examiners are coming, they're examining a patient. A patient has a murmur in cardiovascular station. So all the examiners must agree that there is a murmur, let's say pansystolic. So the purpose is that the signs which are brought in examination, they are very clear, they're not subtle, and there is a standard setting done, and all the examiner agree on this, and they do a certain standard, and they do marking according to that standard. So the minimal pass mark of the exam is 64 out of 82. That is about 78%. So that exam pass mark have gone through a lot of variation. It was different in COVID, pre-COVID, and now finally it is 78% with face-to-face exam. Now, with face-to-face exam, as the seats are limited, they have put certain restrictions to sit again in the exam. Unfortunately, if you take the exam and you fail the exam, so the studies have shown that the candidates who do poor in one exam and then reattempt soon after will also do lower than the expected standard. So they have set a deferment mark. This means that if you score 52 or below 52, so you're not eligible to apply for the next diet. You have to wait for the one diet, and after that diet, you can apply for the exam. So as these are really expensive exam and a lot of stress is going, and also the confidence is shattered if you fail. So what I will recommend is that reattempt only the clinical exam when you feel you are ready, and get feedback, get mocks, get more experience before you are sitting for the exam. Do more practice. Only resit in the exam when you're confident. Appeal results are no longer available. So before that, before the COVID, there was one thing that was appeal. Like suppose you got a pass mark, 1 mark less than the pass mark, or you get 2 marks less than the pass marks, you can appeal. You have to apply some fee, and then you have to say that my station, this problem happened, and can you please remark the station for me? But now this is strictly finished and there is no appeal. You cannot appeal even if you are 1 mark less. You have to accept that result and you have to resit. So here are some resources for the MRCPCH clinical. This list is not exhaustive, but I have brought some of the most important and the main books which we studied also, the guidelines, the pediatric one and the neonatal, the MRCPCH clinical by the Mark BD, the past test series, and short cases for MRCPCH by Angela Thompson, and communication scenario for the DCH clinical exam. So we have an upcoming webinar after a few days, and in which one of another mentor will discuss in detail about how to study, and from these resources, what are the methods and how to study, and they will be bringing more strategies to ace the exam in the first attempt. So don't forget to register and attempt that webinar also. So now I will give you the invitation for any question. So if anyone have any question, but that should be related to this orientation that we have undertaken today about any station, I'm more than happy to answer your question. And if you want to know more and you have any more information, you can see this website and you can email and reach out on our MedPrep online number. And here our team will guide you more about all the things. So I will thank you all for your patience listening, and I will invite for the questions.
Madam, thank you very much for the brief, very excellent explanation of this MRCPCH clinic. My question is regarding the developmental station. You mentioned that if the task is there, we should not take any history regarding the task. For example, if it is ask us to take the motor development, we are not supposed to get history from there. So
Yes.
is it possible?
Mhm.
Because
Yeah.
when you take the history, definitely we'll go for asking gross motor, fine motor in the order, no? So should we skip that and go for that?
Yes, definitely you are going to skip that portion. And that is your task in the developmental assessment that you are going to do the in stepwise in detail. So you're not going to ask. And it is possible that when you will have a proper guidance, so it is possible to not to touch that station. So if your task is do the motor assessment, so you are not going to ask any question from the motor. They will not answer even if you ask.
Okay, then in the assessment, we have to go for only motor, or we have to do the all component.
No, in the assessment, you have only do the motor if it is a motor station.
Yeah, okay, ma'am. Thank you.
Welcome. So you can also type your questions, and you can join this WhatsApp group. I'm also available there, and we are answering your queries there also. Yes, go ahead, please.
Yes. Can I ask you, thank you for your presentation. You mentioned you had their toys in the developmental station. How do you use the toys with the examiner?
Yeah, sometimes they will just say, how will you do? Suppose I'll show the toys here. Yeah. You're not going to exactly use the toys, but sometime you should keep in mind that on the table there will be a doll, there will be a brush, there will be blocks, there will be a puzzle board. So you can use them if the examiner say, how will you do? Suppose if they ask you to make a train, or you say that I want to make a bridge, or I want to make a step tower, 6-step tower or 10-step tower. So maybe they ask how, they can say, but it's usually they are not this is the picture is that, and the list is there to show you that how to use, and you should be in mind. This should be in mind. I hope the answer is clear.
Yes, thank you.
So anyone want to ask the question can raise their hand. Yes, Dr. Muhammad Niyas.
Yeah, madam, again, the same question I didn't understand. In the developmental assessment, for example, if I want the child, I want to check the fine motor like cut scissor, take the scissor and cut the paper. How to ask the role play? Should I ask the role play? Can you please take the paper and cut? Or how to do it that?
Yes, in that case, you will just ask that I want to give the paper and I want to see how the child is holding the scissor. Maybe the examiner will do it like he will hold the scissors in both hand, or he will hold the scissor in one hand. Maybe he can do small cut in the paper, or maybe he can just give you a cue. It's up to the examiner. It's not like universal that they will give you a cue or they are going to demonstrate, but you must ask them.
In that case, the examiner is acting like a child, isn't it?
Sometime no, they are just giving you the information. And sometimes they can act like, suppose I will give you an example. In my exam, it was a social and communication station. So the examiner started to act like a child. He was not responding to anything, and he was not answering to anything in the start. Now then I might make the repo. I started to make a repo, and things then started to came the things on the line, and then he started responding. So maybe he can act, and or maybe he can give the dependent cues. So most of the time they are giving the dependent cues, but it can happen that in the start they may give a tough time. So you should be ready for it.
Okay.
I hope it makes clear answer.
Well,
Yeah. So we'll move to Dr. Abdul Aziz Imam.
Yes. Hi. So it's me again. In your history and management station, you know, in some of the history, it might say, take a history about a child. So do you have two role players in the room, child and mom, or it's usually one role player?
Well, this is a very good question. If you are taking the exam in the UK center, so you will have a real mother and you will have a child. So in the exam, you can have a child and mother both in the room. However, if you are taking exam in the overseas center, so there can be a role player and there may be no child. But let's say if you are taking exam in the UK and there is a child in the history station, then you have to make rapport with the child as well. And if the child is like a teenager, then maybe you have to take history from the child, like this teenager. It's not child anymore. And it happened in the UK center. They are bringing real parents and children.
Thank you.
Welcome. So anyone else want to ask any question can raise their hand. If anything is not clear or you want to ask further queries, you can reach out to us. We are here and we have a very good and experienced team of mentors that are here to help you. Yes, Dr. Nana, please go ahead. So, Dr. Nana, you have raised the hand.
Yes.
That you are...
Hi. Hello. Can you hear me? Sorry, I didn't realize I was still muted. Can you hear me?
Yes.
Hi. Thank you for this session. It was very helpful. I just have one question. For instance, we're in small groups. What would you advise large discussion groups, or would you advise smaller number of people in a discussion group? What do you think? Like, what do you think would be helpful from your experience?
Yeah, this is a very good question, and this is a question that I will give you definitely the
Because
answer.
my concern, sorry to cut you, my concern is the fact that sometimes you can be in large groups and people are just, you're not getting many people to read, because this is a clinical exam and there's a lot of practicals. It shouldn't just be, you can do silent observership in a theory exam. But I feel like, what will you suggest for us to get the maximum benefit? Will you advise like maybe 7 people, 8, or have you found, one benefit outweighs the other between a smaller group or bigger group?
Yes, yes, I will answer this question. So this is a very important question. So if you are a beginner and you have 6 months in your exam, you can stay in a big group in which you will have orientation. You will know maybe about different stations, how the people are discussing, how they are approaching. But if you are near your exam and you have booked the exam and you are already placed and you have secure a seat, so at that time, I will recommend you, and you already have gone through the course once or twice, at that time, I will recommend you to make a group max of 6 people, not more than 6 people, and in which you have, as you mentioned, that in which you have real time to practice, because this is not an exam in which you will stay silent. And practice matters the most, like you will be confident only if you practice and you get feedbacks. I hope it makes the answer clear.
Yes, thank you very much. Sorry, I have one last question to this. Is there a lot of theoretical background that we need to have to be able to approach the clinicals, or do we need to feel confident that we have good clinical skills and just rely on our practice? Or do you advise that we go digging into much of theory just to back up our clinical skills?
Again, a very good question, Nana, and I will also recommend you to attend another free webinar upcoming in which this point will be discussed in much detail.
Okay.
How much theory you are going to read, and how are you going to read these books, and how deep you should go inside the books. So I hope that all of these answers you will be getting on that day. But however, I will answer that you don't need too much theory.
Okay.
You have, exam is all about the practice arts and the clinical skills, how much you are sharp, and your
Okay.
previous experience in the pediatrics.
Okay. Thank you. That's helpful. Thanks a lot.
Welcome. So it's better to ask the question if you have any question by opening your mic, and it will help also other candidate if they have any question in their mind.
Hi, ma'am. I have a question regarding if someone is not working in the pediatrics or is working in some specialty of pediatrics, how important is it to go to the pediatrics to attend the clinical wards, clinical rounds, or is it only sufficient for 2 weeks just before your exam to go and revise your clinical methods?
Well, Dr. Ahmed, this is an important question, and I think that most of our colleagues and some of our colleagues definitely will not be working in the general pediatrics, and they are maybe working in any subspecialty. So whenever you are planning to get exams, so at least you should have 3 months before the exam. You should start going in the pediatric wards, general pediatric wards, and you should get a feedback assessment, and you can practice under supervision, and that will sharpen your skills. And also because if you're working in any subspecialty, so your reflexes are not like if you're working in a general pediatrics. So reflexes will make some need some time, and I don't think so that it's possible only in 2 week time. I hope that is clear.
Yeah, it's clear. Thank you.
Thank you. So any one of our colleague want to ask any question or anything that we can discuss more in detail, you're welcome. You can also reach us on our website or about the email which I shared here. And we can also answer you in the WhatsApp group. So the link is already shared in the chat. And do remain on touch on the page, because we are announcing some very thrilling things there that are upcoming, and they are very exciting things that the MedPrep online team is bringing, and it's a very great initiative that they have started to help all of that candidates there, and to help them to reach. And definitely these free webinars are going to provide you a very good insight of the exam. Yes, Dr. Abdul Aziz Imam, you can ask.
Sorry, I just had another one. Is there a tactic for getting the minimum score? I mean, outside knowing the knowledge, is there a tactic for getting the normal score? Sorry, at least the minimum score. Maybe you don't have to score maybe a certain number or a certain value within the context of a station.
Yeah.
Is there some tactic?
So today's webinar is the main tactic, And main strategy, how you will get the exam numbers. I think that I have discussed in detail about all the domains, which areas you have to focus, how you should study, and what questions the examiner are looking for, and what they are, and you should be prepared for these answers. So if you can watch this webinar again, that will be present in our YouTube and Facebook channel, and stop the slides and do the preparation according to it, that what I guided today. So it is the simplest tactic, because you should know, focus only the areas that they are going to ask. So one of the doctor has asked about how important is the summary in the clinical station. So yeah, that is important because the time is short, as I already told you. So you have to summarize only the key findings. You are not going to summarize the all the station, and we are here to help you, and we will also guide you how to summarize in the clinical stations. If you want to know more, so you can reach out to us. For those who have missed the session and had not started from the start, I will request my admin team to share the link, and you can watch that because that session will be present recorded. And I hope that few of the doctors that asked me questions today, like Dr. Abdul Aziz Imam and Dr. Nina and few more other, I hope them to see you in the next upcoming webinars. And the doctor who was asking about the tactics and about how to study and how we should do the preparation. So I hope that I can see you in the next seminar as well, webinar, and you will get more and more insights, and a lot of queries will be answered there as well. So Dr. K. Wubu, about the communication station, we're going to guide you, and but it's beyond the scope of the webinar that we can talk about it, about the problem solving aspect of the communication station. And I think that will be covered in the courses. You can contact the admin team and they will guide you more about it. Thank you for your question. So if anyone don't have any question, so we will end this webinar. And I hope you all good luck, those who are preparing for exam. And we at MedPrep online team, we are a team of mentors here. We are going to guide you. We are here for your guidance. And we are also bringing some free webinars and some exciting and thrilling things. So stay tuned and be updated on the page that we are regularly and daily updating. And see you soon in the next webinar. Thank you for all the participants for sparing their time. And especially I would like to thank for the participant who have asked the questions, and because that also solve the queries of other students. And thank you very much.
Thank you.